First of all, I'd just like to outline, again, the problem, and it goes across all socioeconomic statuses. I have a high school friend in my class who recently died at age 54. She had schizophrenia. Their life expectancy is shortened. Um, she had two children, and her husband divorced her and changed the children's names, and she ended up on the street because of really probably a multitude of factors, but one of those was her ability to get treatment. I also had a high school friend who came home for Christmas break in college and broke up with his girlfriend, and a couple weeks later committed suicide at college. No other indication. But the question in my mind is on college campuses, was there any indication that he was struggling? And that's true because my son, who's one of his fraternity brothers, who graduated in May and who had a job, just committed suicide at age 22. So this is really something we need to address. 22 veterans a week we're losing. I just wanted to outline the problem, as we all know, but for the record. And it is important to know that most mental health patients have other medical issues. There in Indiana, there are a couple centers close to my district, Centerstone and Bloomington, Hamilton Center and Terre Haute, that coordinate both traditional medical problems and mental health related issues, including substance abuse disorder. Dr. Trangle, this is a subject that's really. Also, I was a medical doctor before I was in Congress. I was a surgeon, so I understand this. Why do you think it's been so difficult to get mental health parity and treatment for mental health issues? I mean, they can be chronic problems, I understand. But, diabetes, congestive heart failure, these are all chronic problems. Why? I mean, I think we all know probably the answer, but in your experience, why are we still struggling to be able to have parity in how people are treated because they happen to have a mental health issue?
I think the tradition in medicine is to have things siloed up, and not thinking holistically, not having people be physically in the same place, not sharing the same EMR, and not talking about these things. I mean, some of the examples you mentioned, diabetes, cardiovascular disease, heart failure has a significantly increased incidence of depression. If somebody has an AMI and they're depressed and you don't recognize it, they'll have higher mortality, not because of the physiology, because they don't do their cardiac rehab. We need to screen for depression throughout all of primary care, throughout health plans members, and then make sure that for those that are screening positive, we follow up. Ideally, you follow up in primary care clinics where you don't have to get somebody to get over their own stigma and go to a more embarrassing place of a mental health clinic. Yeah. You need to be able to virtually talk to the primary care docs and help them with advice, with recommendations, with consults, things like that.
Mr. Saley, maybe you could help because you're involved in dealing with trying to help people get coverage. I mean, I mean, as a healthcare provider, I'm still for years I've had this issue. I mean, I had patients that were inpatients that I did open heart surgery on that clearly had mental health issues. I diagnosed a number of people who were bipolar and depressed and everything, and had a hard time getting. There's a physician shortage which we can address, but why? What in your mind? What's your opinion? Why? What's the impetus for difficulty getting coverage for, say, depression versus diabetes? I mean, it doesn't make a lot of sense, really. I mean, do you have any insight into that?
Well, I have a couple of thoughts about why the parity law, which is a landmark law, why has been hard to implement. First of all, there's a patchwork of agencies that have to enforce the law. So we have the federal government, which directly enforces it with self-insured plans, and also can provide guidance to state agencies. And then you have 50 state agencies, Division of Insurance, and also Medicaid offices that all have to enforce the law in all different ways. So there is a patchwork of interpretations of the law.
I guess the question is, why would you need to have to interpret it? Why do you need a parity law in the first place? Maybe you see what I'm trying to get at. I don't know if we can answer that question today. I think
Dr. Bucshon, I think,
maybe Greenberg,
if
have any insight?
you don't mind for a second, Mr. Selig.
Yeah.
I think part of the issue too is that there's a great stigma associated with mental health and addiction, and so we have treated typically mental health and addiction in our healthcare system differently than behavioral health, not that's not the right answer, not the right thing to do. But people are afraid to talk about their mental health and addiction for fear of being ostracized.
Thanks.
Or
We're going to have to get
treated
some more questions
differently.
in, so hopefully you'll have the opportunity
Yep.
to answer
I yield
further
back.
through some other questions.